Hey everybody, Alyssa here with Preferred Physical Therapy, where we help people age 40 plus stay active and independent, live free from painkillers, and avoid surgery. Today I'm going to talk about UpperCrossed Syndrome to kind of go along with the postural head-neck exercises we're talking about this month because it's a common thing we see in the clinic and in our day-to-day life. So UpperCrossed Syndrome refers to a specific set of muscular imbalances, overactive and weak muscles that we tend to see with poor posture, driving, excessive use of computers, phones, all of those things. So what tends to happen is that we notice a weakness in the front muscles of our neck and a tightness in the muscles in the back side of the neck. To go along with that, it kind of makes an X. So if these muscles are weak, we're also talking about the weakness kind of in those lower shoulder regions and then a tightness in the front of the chest. And so it kind of makes an X or an cross syndrome on the upper part of your body, which tends to lead to like that forward slumped hunch posture where we notice a lot of people's heads are coming forward, all of those things. So we're going to talk a little bit about why that's bad and some ways to counteract that, including some of the exercises we talk about in these videos this month. So what we tend to notice is that it's a hunched over posture, and it's not just gonna happen one day. It's a repetitive over time. A lot of people who do desk work, and we're noticing a lot more in like kids that are on their phones, playing video games more often, and just not sitting in a very good position. That's why it's really important that if you are working from home now, or even working in the office, that you do try to set up your workspace as ergonomic or as ideal as possible to avoid some of that awkward, I'm working at my kitchen table, but it's just not set up right for me. And then you're noticing my neck feels tight, my chest feels really tight, it's hard to take some deep breaths, I'm getting more headaches and just more tension on the backside, because those are some of the negative effects that we can notice with this UpperCrossed Syndrome, in addition to just being stiff and achy all over. The good thing is that the main treatment for this condition is exercising, stretching, all things that are super easy to do at home right now. If you go to the gym, you can do them there too, but a lot of things that people who are staying at home right now can do as well. So, like I mentioned, the causes just tend to be that I'm sitting at my desk, I'm hunched over, I'm doing a lot more on the computer. Maybe you have a little bit more time now, so you're getting to watch more TV, you're reading more books, maybe you're going out biking and enjoying the nice weather, but you're just not being very conscious of how you're sitting up, your posture, all of those things. So like I mentioned, we tend to notice that from the side here that people are really rounded in through their back and their head is really jutted forward with this. It may get worse over time. It might be something where you just notice you feel like you're not up as tall as you used to be, but you don't want to be hunched over in the next couple years. So now is the time to kind of address that to avoid any of those headaches, chest tightness. Even though it's on your upper back we're talking about, a lot of people will find that they're getting low back pain just from that lack of movement up through here, stiffness, achiness. The movement kind of has to come from somewhere, so it's taking our strain on our lower back. So big things. We go over a couple of the exercises. One of the biggest things is to just open up the chest muscles, kind of reduce that forward shoulder, decrease that rounding that we're getting through our back. And so I go over some scap retractions, meaning just sitting up nice and tall and imagining you're squeezing a pencil between the shoulder blades. We tend to see people do this really aggressively. They're like trying to squeeze as hard as they can, but that's not a sustainable posture. So what you do want to try to do is just stay up tall and like a gentle squeeze, something that you feel like you could maintain for a longer period and it's not a really hard pull. That can cause a little bit of discomfort in through the front of the chest. Any exercises that you can do to loosen up the front of the chest, strengthen the back, strengthen the neck muscles, as well as decrease some of that tightness that we tend to see in the back part of the neck, kind of into the top of the shoulder area where a lot of people find that they might have some knots, all of those things. So it's one of those things where it's super easy to just find some gentle exercises. We've gone over quite a few here on our website, and then in some of those Technique Tuesday videos, as well as if you feel like it's contributing, it could be the cause of your headaches or maybe why you've just felt like it's really hard to take a breath. It's one of those things where you may want to get it checked out before it becomes worse. So if you do have any questions, always feel free to reach out to us, give us a call, drop a comment below and we'll get back to you. But otherwise, I hope this was helpful and you all have a great week. Thanks.